I'm Dr. Barry Eppley, plastic surgeon of Indianapolis. I wanted to review a case of chin augmentation in which a chin implant is really not the ideal solution to the problem and at best may just be an additive solution to the underlying chin problem. In cases of severe chin deficiency, as we see here, this is always representative of the fact that the actual lower jaw or mandible is short. This patient would be ideally better from a long-term standpoint to undergo orthodontics and ultimately lower jaw advancement, but like most patients in their mid to late 30s, this is really not a viable option for many of them. Therefore, I had to look for just correction of the chin. While chin implants are by far and away the most common method of chin augmentation, when you get into very severe deficiencies, usually larger than 15 to 20 millimeters, a chin implant is usually going to be inadequate simply because they are not made that large and the stretching of the surrounding soft tissue may not do well with a chin implant alone. And here we can see that if you trace out what is believed to be his lower jaw position, you can see how deficient that is compared to his other. In these type cases, a chin osteotomy, or cutting the chin bone and moving it forward, is really a better alternative. And it is generally my approach that any deficiencies greater than 10 to 12 millimeters, I really like to do a chin osteotomy, because I feel it provides a better long-term solution than a chin implant alone. In a chin osteotomy, also known as osteoplastic genioplasty, the chin bone is horizontally cut below the level of the nerves just in the front of the jaw, and then it is moved forward and held into place with plates and screws. This does not require the jaw to be cut itself, and this has nothing to do with repositioning the teeth, so patients' fear about having to have their jaws or teeth wired together do not apply in this small chin bone movement. And here we can see in this case from a view inside the mouth with an incision, the chin bone is brought forward. Because his chin bone was not very big, he could only get 10 millimeters of advancement, and in this unusual case I put a chin implant on top of moving the bone forward to try to give him the most projection as possible. This is certainly unusual, and usually one uses either a chin implant alone or a chin osteotomy alone, but this case with its severe near 30 millimeters deficiency required both. And here we can see in profile that he has had a significant improvement not only in the horizontal dimension of coming forward, but notice that the chin is also vertically longer as well, and that is something that a chin osteotomy can do that a chin implant cannot do as well. By actual true measurements, dropping down a vertical line from the Frankfurt horizontal plane, we can see that his chin point is still inadequate, as this should be closer to this line, but certainly far better than it. And again, notice how much better the chin looks in the frontal view, because it has not only been brought forward, but it has also been brought down and lengthened, creating an overall better three-dimensional change for him. Again, this is something that a chin osteotomy can do better than a chin implant can in most cases.